So does the season for warts. Embarrassing and unpredictable, unsightly warts can appear when you least expect them. But with a little patience, you can kiss your warts goodbye for good. Joining us with the latest from Columbia University College of Physicians and Surgeons is dermatologist Bruce Katz. Welcome back to the show, Doctor.
Thank you, Carol.
Exactly what is a wart? What is it? I mean, we know what they generally look like and how annoying they can be, but what are they?
Well, warts are really little growths, or sometimes even large growths of tissue on the skin. And they really come from viruses. Various types of viruses can cause a variety of different types of warts.
Give me an example.
Well, often you see the common warts on the fingers or on the feet, on the elbows or knees, more often in children, but we also see them in adults too.
We're looking at what a common wart would look like. What is the virus involved in that?
Well, there are a number of different types of wart virus, from type 16 to 24. It depends on actually the area of the body. But they can be small little growths, or sometimes they can get very large and very uncomfortable for people too.
Okay, but let me just, I don't want to beat a horse to death here, but when you say virus, people think of a virus they pick up, you know, on a day-to-day basis, a cold virus or a flu virus or something like that. Is that the kind of virus base we're talking about here?
Well, it's related to that type of virus, but it's really a skin virus that really only infects the skin.
Okay, so we just took a look at a picture of the common wart. What about is that the most common wart? Is the common wart the most common one?
Well, that's one of the most common, but we can also see warts that occur on the bottom of the foot. We call those plantar warts.
Okay.
Sometimes people get very, very tiny little flat warts, and they often occur around the face, on the cheeks, or on the chin.
Okay, so we're looking at plantar's warts, and then, of course, there's the flat wart.
That's right.
Now, we're seeing examples where many warts exist. Is that usually the pattern? If you get one, do many others follow?
Well, that can often happen. If you get one wart, dermatologists usually recommend having it treated as soon as possible because they can spread. And one starting on the chin may spread, as you saw in that photo, to cover the entire face at times. So it's always a good idea to treat it as early as possible.
Now, is there any particular, I mean, there's no contagion factor here. It isn't touching the wart that would then create the wart in another part of your body.
That's true for the most part. When we talk about common warts or flat warts, it's unusual for them to spread. But there is a type of wart which we call genital warts, which can have a risk of spreading, and even more importantly, can be associated with cervical cancer in women. And we call those types of warts condyloma acuminata. And those warts should be treated as early as possible, and particularly when people have relations, they should be protected.
So that is something that would result from sexual contact?
Exactly.
Okay. Let's go back to the common wart, the flat wart, and the plantar's wart and talk about the ways that you get rid of them now. So let's start with the common wart. What's the best way to get rid of the common wart?
There are a variety of different home remedies to start with. People can go into the pharmacy and try to use medicated plasters or pieces of tape or liquids. We call these acids that are used to treat these warts.
And are they effective pretty much? This is over-the-counter stuff?
Very moderately, not often terribly effective.
Okay, so usually you would have to see, we have about a minute left, so I want to make sure I get the answer to all of this. Generally you would see a dermatologist about a common wart and get it taken care of that way.
Exactly.
What about the flat wart? Same thing?
Same thing. Flat warts can be treated by dermatologists.
Is that a topical procedure or oral procedure? How are they taken care of?
Well, they can be treated topically. We can use acids. We even have lasers now, and particularly at our center, we can use lasers to treat warts, new types of laser treatments.
And it won't scar your face for the flat warts on your face?
If it's used properly, no.
Okay. Right. And the last one, the plantar's warts, those are generally surgically removed?
Often they are. We try to use sprays on them, surgery, and lasers too.
Yeah, because the plantar's warts can really dig in when you're walking and be very painful.
Very painful. Indeed.
All right, Dr. Katz, the solution to the most common warts. We appreciate it. Thanks for joining us.
My pleasure.
It's the latest solution for infertile couples.